If you are over 60 and sciatica exercises are not giving you lasting relief, there's a specific reason that most videos are not addressing. The exercises most people recommend were designed for a younger disc herniation, not for the structural changes that happen in the spine that's over 60. In this video, I'm going to show you 3 exercises that are specifically targeted for how sciatica behaves after 60. And stay until the end because the third exercise is the one most people never do, and it may give the most relief for your age group. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years of clinical experience in gait analysis, biomechanics, and neurology. This channel is for people dealing with chronic pain, people who want a real step-by-step strategy that addresses the root cause of their problems. If this sounds like you, subscribe below and tap the notification bell so you do not miss my weekly videos. The most common pattern I see in patients over 60 is this. They do the exercise consistently and they feel better for a few days, and then the pain comes right back. If this sounds familiar to you, the problem is not effort or discipline. The problem is trying to apply a solution that was designed for a spinal condition in someone who's much younger. You see, after 60, the lumbar discs have less water content and are thinner, meaning they've lost some of their height and mobility. The spinal joints have accumulated some degenerative wear and tear, and also degenerative arthritis. The spinal canal may have reduced space around the nerves, which is called spinal stenosis. This means the spinal nerve roots and the sciatic nerve are already under more mechanical tension before you add any exercise movement at all. This tells us 2 important things that you need to consider for this age group. Number 1, you need to restore nerve mobility, meaning you need to relieve the tension on the nerves. And number 2, you need to correct for the pelvic alignment. Aggressive sciatic stretching addresses neither of those things directly. The exercises I'm about to show you today target both of those things, and they're suitable for people with sciatic leg pain who are over 60. Before I show you these 3 exercises, there's one important distinction you need to understand. After 60, there are 2 primary causes of sciatic that can look identical from the outside, but respond very differently to exercise. The first is disc-related sciatica. This is from a disc herniation or bulge that's pressing against the nerve root, like L4, L5, or S1. This typically causes pain that starts in the low back, runs down the back of the leg, and tends to get worse after sitting for 20 to 30 minutes, lifting or bending forward. The second is stenosis-related sciatica. This is where the spinal canal starts to narrow and the nerves are being compressed from multiple different directions. This pattern typically causes heaviness or aching in both legs, especially during walking or standing, and improves when you sit down or lean forward. Now here's the important point about these 2 causes of sciatica. The exercises that help one condition can sometimes aggravate the other. Extension exercises that press-ups or cobra stretches are commonly recommended for disc herniations because they may help reduce pressure on the affected disc and nerve root. But for someone with spinal stenosis, those same movements can narrow the spinal canal even further and increase pressure on the nerves. On the other hand, flexion-based exercises where the spine bends slightly forward are often more comfortable for stenosis because they create more space around the nerves. The problem in those same flexion movements, however, is that they can sometimes increase pressure inside a herniated disc and aggravate disc-related sciatica. This is why so many people over 60 feel confused. They're doing exercises they were told would help, but the exercises may not match the actual cause of their sciatica. The 3 exercises I'm showing you today are designed specifically for people over 60 with sciatica. They may help reduce nerve irritation and mechanical compression without aggressively forcing the spine into positions that could aggravate the sciatica caused by either a disc herniation or lumbar stenosis. The first exercise is the seated sciatic nerve floss. Most exercises for sciatica target the muscles surrounding the nerve. This one targets the sciatic nerve itself as well as the spinal nerve roots. After 60, the nerves can develop what's called neural tension and adhesions, where the nerve loses its ability to slide and glide freely through the surrounding tissue. Even when there's no active compression from a disc, this restriction can cause ongoing irritation down the leg. The seated sciatic nerve floss will help break those adhesions and improve the nerve mobility within the neural sheath, and it may relieve the sciatic leg pain quickly, sometimes almost immediately or within minutes. Here's how you do the seated sciatic nerve floss. With the seated sciatic nerve floss, you want to imagine the nerve running from the brain down the spinal cord, out through the spine, and down the back of the leg to the bottom of the foot. This full long nerve can have areas where it's getting pinched, irritated, or compressed. And what you're trying to do is just gently glide it up and down to break up the adhesions and move it away from the area of irritation. The way in which we do this is sitting comfortably on a chair with your leg out in front of you, knee straight. What you're going to do is you're going to tip your foot down to the ground as far as you can go at the same time as bringing your chin to your chest. Then, once you get to that position, you're going to extend back up, bringing your foot as high up as you can, while at the same time extending your head. Over 5-second intervals, you'll just keep rotating from down back to up as far as you can. And you want to continue this for about 10 repetitions. This should be fairly comfortable. You may find a slight irritation, but it shouldn't exacerbate or worsen your symptoms. If it does, discontinue it. But generally, you want to try to do this over 5-second intervals for 10 repetitions, and you can do this 5 to 10 times per day. The second exercise is the standing hip flexor stretch. When the hip flexors stay tight, they pull the pelvis forward, and that increases the curve in the lower back and adds pressure around the spinal nerves. After 60, this becomes very common because most people have spent years sitting for long periods. Over time, the hips stiffen and the pelvis starts loading the spine differently. One of the biggest frustrations I hear from patients is that they feel okay sitting, but once they stand or walk for a while, the leg pain or heaviness starts creeping back in. A pattern I see all the time is tight hip flexors, keeping the low back slightly compressed all day long without people realizing it. Most people focus only on the sciatic nerve itself, but often the mechanics around the nerve are part of what keeps the irritation going. This exercise helps open the front of the hips and takes pressure off the lower spine by restoring a more neutral pelvic position. Here's how to do the standing hip flexor stretch. The standing hip flexor stretch is meant to loosen up the muscles in the front of the hip and to allow the pelvis to tilt back to take tension off the spinal cord, the nerve roots, and the sciatic nerve. In this stretch, what we're going to do is we're going to leave the symptomatic leg where it is below us. We're going to take a step forward with the asymptomatic leg, and we have a chair position in front of us to help us balance. Once we're in this position, what we're going to do is just gently push our hips towards the chair and keep our upper body upright. As we do this, you're going to feel just a gentle pull in the front of the hip on the side of the leg that's extended behind you. As you're doing this, you want to just breathe nice and easy and hold that stretch. You should just feel a gentle amount of tension again in the front of the hip. Breathe and hold for about 30 to 45 seconds. Once you've done this, you can relax back up. And what I would suggest is do it for both legs, both the symptomatic leg and the asymptomatic leg. So just change position to do the stretch. This helps the pelvis to stay balanced and to start to settle back and take tension off those nerves. When you do this, remember, it's important. You hold for 30 to 45 seconds each time you stretch to allow the muscle to start to lengthen, the pelvis to tilt back and hold that positioning. And then you can do it for 3 to 5, up to 10 times per day. If you're very acute and symptomatic and there's a lot of pain running down the back of your leg, I'd suggest maybe just doing about 3 times per day. But if you're starting to resolve and get better, you can do this a little bit more to help really start to elicit some change in the alignment of the pelvis. The third exercise is the 90-90 sciatica relief position. This may not look like traditional exercise, but for many people over 60, it's one of the fastest ways to calm an irritated sciatic symptom. As the spine ages, the discs lose height, the joints stiffen, and the space around the spinal nerves becomes more sensitive to compression. Sometimes, the problem is not that the body needs more stretching, it actually needs less pressure. And one of the biggest mistakes I see people constantly trying to push through pain with more movement, more stretching, and more exercises while the nerves are already irritated. This position does the opposite. It allows the lower back muscles to relax, reduces pressure through the lumbar discs and joints, and helps to unload the spinal nerves in a very controlled way. For patients with disc-related sciatica, this position can help reduce irritation around the affected nerve root. For patients with spinal stenosis, the gentle flex position often creates more space around the nerves and decreases that aching or heaviness down the legs. A pattern I see over and over is patients standing up after this exercise and saying the leg feels lighter, less tense almost immediately. Here's how you do it. The 90-90 sciatic relief position is where you're going to get the least tension on the sciatic nerve and the lumbar spine. So this position is great when your sciatica is quite irritated, just to get tension off it and find some relief for a short period of time. The way in which you'll do this is you use a small pillow or towel on the floor for your head and a nice flat surface like a chair, a couch, or in this case, I'll use a stool just to show you how it's done. What you're going to do, and if you need someone's assistance, it's good to get them to do that for you. You can have them position the towel or position the chair once you get laying on your back on the floor. But what you're going to do is you're going to get yourself in a position where you're lying flat on your back with your legs bent up at 90 degrees. So again, it's called the 90-90 position because your hips are bent at 90 degrees and your knees are bent at 90 degrees. Once you're in this position, you want to just relax and try and let your spine just flatten out against the floor. Rest your hands on your stomach, and you want to breathe nice and easy through this. As you get into this position and you start to relax, you should feel relief from the tension in your lower back and your sciatic nerve. This position can be held anywhere from 1 up to 5 minutes if you're finding it comfortable. The important part with this is to breathe, relax, and really try and let your spine just flatten out against the floor. Once you've completed your 1 to 5 minutes, what you want to do is instead of trying to sit up, is you want to just roll over to the side, get yourself up on your hands and knees, and then get up from that position. That's the easiest way to keep tension off the spinal cord as you're doing this. If you need help from someone, elicit that help before you get down into that position. These 3 exercises work together for a reason. The nerve floss helps the sciatic nerve and spinal nerves move more freely through the surrounding tissue instead of staying irritated, tight, and mechanically restricted. The hip flexor stretch reduces the constant pull of the pelvis that keeps compressing the lower lumbar spine throughout the day. And the 90-90 relief position helps unload pressure through the lower back and calm irritated spinal nerves, especially for people over 60 dealing with stenosis, disc degeneration, leg heaviness, and pain that builds during standing or walking. Most people try to fight sciatica by stretching harder, pushing through more exercises, but after 60, the goal is usually different. You need better nerve mobility, better pelvic mechanics, and less pressure around the nerve roots. That's what this video is aiming to show you. The patients who improve the fastest are usually the ones who stop constantly aggravating the area and start reducing the mechanical stress, feeding the irritation every day. Done consistently, these exercises may help calm the leg pain and improve the walking tolerance and reduce the constant ache, burning, or tightness that keeps on returning. The goal is not just temporary relief. The goal is giving your spine a better environment to function in over the long term. If you got value from this video, hit the like button and share it with someone over 60 dealing with sciatica or leg pain, because a lot of people are still doing the wrong exercises for this age group. And drop a comment below if you notice one specific movement or position that makes your leg pain worse. I read the comments and it helps me to know what videos to make next. Subscribe to the channel below if you want more videos focused on sciatica relief or spinal health, posture correction, chiropractic care, disc injuries, and long-term solutions that actually correct the root cause instead of just temporarily masking symptoms. Now, if you've tried exercises like these and your leg pain still keeps coming back, there may be a deeper issue involving your spinal, pelvis, or overall alignment that has never been properly identified. And that is exactly what I explain in this next video. I'll show you the specific corrective strategies we use in the clinic to help patients address the underlying mechanical causes of chronic sciatica and persistent leg pain. So go watch this video next.